with the shoulder, I'm always really cautious with the shoulder. I'm not going to show you any closed pack position, because the shoulder is somewhere where you can definitely hurt one of your fellow students, patients. You have to be comfortable with doing the joint nose. I'm going to show you the positions. We're going to do everything. It's going to be loose pack, but still, when you start off, go nice and easy. Okay. Before we ever do anything. Because before we do the shoulder, we really should assess the glide. If we're going to assess the glide, because we don't want to all of a sudden start doing joint move on one of us in here, and then all of a sudden you dislocate someone's shoulder. Okay? So if someone already has a problem with their shoulder, don't just hesitate and wait until Jessica's getting ready to do the move, and then all of a sudden go, oh yeah, my shoulder, I'm a chronic dislocator. So what we're going to do to assess the mobility, we're going to just stabilize here. Nice. Feel that? So anterior she's loose. Posterior she's loose. That's all good. Okay. So what we're doing right here is stabilizing. She slides in, she slides out anterior. But this is good to know. Yeah, that's good to know.
So don't practice on it.
No, we'll try this. And now, if you guys could come up here close.
They'll tell you what you
At you.
Okay.
because they know it.
Okay, you guys know what loose pack position is for the shoulder?
Maybe not on this one.
What? Nope. 90? No. Okay, so we have 50 degrees of shoulder flexion and 25 to 35 degrees of abduction. So usually what I say, so you're going to stay in this area here. And what I like to do is just for you guys, when you get close, is picture the shirt as the inferior joint capsule. Okay? So as she goes up, you see it gets tighter, right? As we go back down, it's loose. Think of that as a capsule. If you can get a visual, I think it really helps. So here we go, it's tight. Come back down, the capsule's loose. Correct? What was that? Do you guys see that, what I'm talking about? Because if you understand what you're going to stretch, it makes everything easier. So here's our capsule, gets tight and loose. So if we're going to do a loose pack position for an inferior glide, will you tell me that? How? Here we go. This, we don't always do this. We don't always cover our patient's face. We don't want to see the pain. This is just going to help. What we're going to do, so our proximal hand is going to stabilize in the armpit. Distal hand is going to be just above the elbow. Her hand, she's going to hold on to my love handle. Okay, you can hold it. Okay, there we go. And then go ahead and relax. What we're going to do is straight inferior glides. All we're going to do is rotate our body. You alright? So an inferior glide is going to help with what? So we're stabilizing our concave, we're moving our convex. An inferior glide, think about it. What direction? So shoulder flexion, shoulder abduction. Nice. So shoulder flexion, shoulder abduction. Remember that. You'll definitely see it.
Multiple times.
Yeah. Okay? So here's a loose pack. So we're about 50 degrees of shoulder flexion, 25 to 30 degrees of abduction. It might be a little bit more. My hips are wider. But what we're going to do is all you're going to do is rotate your body. Right here. This is a straight inferior glide. Our treatment's going to be 20 to 30 seconds. And then we go ahead and relax. You all right?
On this one, you are doing a hold. You're not going to do the opposite.
So we just go ahead and start a hold.
When you say rotate, you're rotating.
I'm just rotating. I'm just turning my hips. I mean, you could just pull. That's fine. But if you always want to think of every mechanical leverage that you have, especially if you're smaller, because so you don't have to use your muscles all the time. If you're doing this all day long and you're going to get tired, it's easy if you can pick things that, okay, all I have to do is rotate a little bit and I'm using my butt to do the work, then that's better. Okay? So that's an inferior glide that's going to help with shoulder flexion and abduction. Okay? So being in the same position, I'm going to do this just a second. So we just called this an inferior glide, right? We also can call this traction, right? Just a little bit of traction. So if we're going to do a posterior glide, we're going to stay in the same position here. We do a little bit of traction. Our moving hand now, we want to think treatment plane be as close to the joint as possible. Okay? And this is where we're going to do a posterior glide.
Is his elbows locked out and the force is almost slightly lateral, like a
posterior lateral direction. So slight traction. I was going to say this direction. Slight traction, and then a posterior glide. Hold it for 20 to 30 seconds. Back up for you, all right? Okay. So posterior glide. What's a posterior glide going to help? Extension. No. Extension. So we have shoulder flexion, right? Because for shoulder flexion, the very first thing that happens with shoulder flexion is we have the humerus start to drop posterior and now inferior. Okay? Posterior, inferior. And then we also have with our posterior glide is going to do what?
Internal rotation.
There we go, internal rotation. Okay, so internal rotation. You guys got that? So, think posterior glide is going to increase internal rotation, and it's also going to increase shoulder flexion.
So how do you know if they're limited in flexion, if you're going to do posterior or inferior, or do you do both?
So one more time, how do you know?
If say they're limited in flexion, how do you know if you're going to do posterior or inferior?
You'd probably do both. That's why the shoulder, like I wait to go over the shoulder because I think it's a lot more complex than doing the wrist, knee, hip, ankle, fingers. You have to really understand what you're doing because we still say the concave convex rule, but you're going to get multiple directions that one mode's going to help. You can't just say, okay, here I'm going to do a posterior glide and, okay, I'm working for shoulder flexion, right? Because it's also going to help with internal rotation. Where if we're at the ankle and we say, okay, or at the knee, all of a sudden we're doing a posterior glide, okay, you're working for flexion. We don't have as many movements or motions that it's going to affect.
On the practical, you'll be given the limitations. You would just tell me that you could do either one, but you would only have to demonstrate them.
Okay. So right here in our same position, now we're going to do an anterior glide, and I'm going to show you this two different directions, two different ways. So we can stay right here, and go ahead and relax. Same position, and we stabilize, and we're doing an anterior glide. You see that? So we do an anterior glide. Good morning. So once we do our glide, so we're stabilizing our concave, we're going to move our convex. Anterior glide. You're are you alright?
Are you still doing traction too?
Slight traction and anterior glide. Okay, so anterior glide is going to help for, say what you said last time. Okay, extension. There we go. She knew it. She was ahead of us.
I'll never forget.
No. So anterior glide is going to help for extension and external rotation. Okay? Those are the things you need to think about. So while we're here, let me run through it one more time before I have Midori flip over. So our inferior glide is going to help for shoulder flexion, shoulder abduction. Please tack inferior glide position. We stabilize shoulders at about 50 degrees of flexion, 25-30 degrees of abduction. All we have to do is slightly rotate our hip. Are you alright? And we do our hold.